example. I just really want to talk a lot of the ground has been covered by Stuart, both in the questions and answers and in the report itself, and in this presentation. But just say I suppose I'm informed by some of the work I do with Vincent de Paul, with Northside Partnership, and many community groups in the inner city of Dublin and on the north side, and there are common themes. One area I just really want to emphasize, perhaps above all else, is the exacerbation of inequality as a result of the pandemic. And I heard a professor, a medic on Morning Ireland yesterday, I can't remember his full name, Professor Seamus, I forget his surname, but in Cork, but he said, it was just one line I picked up on, and he said, pandemics magnify inequities, and I think that's, we can relate to that. And I think a lot of the reports and commentary since the pandemic, which is just now over a year, have supported that. Not just anecdotally, which we know from engaging with people on an individual basis, but on various reports too. Stuart's there points to that. ESRI has talked about, they had a report recently where it shows that quite a number of people have accumulated savings. So a lot of people who are more middle class, who would spend a fair bit of money on holidays, multiple holidays, eating out, food, etc., are accumulating money. So hopefully the economy will benefit when restrictions are eased. But they are in many ways better off in a financial sense, and they've continued to work. Whereas other people in precarious and low-paid employment perhaps are not working, but also they are spending and have to spend more money on food, on heating, and even trying to get connected digitally. And of course, we know about the digital divide. We know about already there's evidence of inequality in education, where people haven't had the opportunity to engage properly in education, where the homes aren't conducive to study, where there's physical cramping, where parents may not have the necessary resources within themselves to support their children in education. And of course, education is the single biggest factor in addressing inequality and poverty, which we used to say employment, but it is education now. And the findings, Stuart's findings mirror to a great extent some of the early reports from Vincent de Paul. And I'll come back to what Vincent de Paul said yesterday, and Stuart has mentioned quite a number of them there, but it's timely. But even early days of the restrictions, when the first lockdown, if lockdown it was, the people who were engaging with Vincent de Paul were very similar to, the trends were very similar to what MABS is experiencing. An increase in people, single adults living alone, often with health issues. Carers, people having to look after who became carers in many ways, because the normal carers or resource centres and drop-in centres for people were closed, so they were not able to work, but they had to look after their maybe siblings or family members. Over 65s, increasing number of over 65s engaging, who are, I suppose, were cocooning, to use that phrase that came in vogue, and weren't able to go out and do their normal financial translations, and they deal mainly in cash to a great extent, and not online banking and so forth. Travellers, of course, who have suffered hugely, both during the pandemic, and who are one of the most marginalised groups in our society, if not the most marginalised. People, as I mentioned, in precarious and part-time employment, people doing, funny enough, essential services too. There was a recognition at one level that they're doing essential services, but they're low paid actually. Many of those people providing essential services to keep our economy going, to keep our society going, who are still doing actually in low paid employment. That was one pattern that, and findings that endorse, that is so corroborated, to use Stuart's term, by SVP, but as I say, other reports from ESRI. I'm also conscious that behind all those figures, there are people, real people, MABS, frontline people engage with them, obviously, maybe remotely at the moment. But the Vincentian Partnership for Social Justice did a very good report that was commissioned by the Society of St. Vincent de Paul, where it did a case studies on people who are living below what they call and which is now accepted as the minimum essential standard of living, the MESL. And there's a significant differential between what's considered the minimum essential standard of living, that people can live with dignity, not with excess and not in luxury. The differential between that and the social welfare payments. And it was very interesting when the pandemic unemployment payment was first set, how it was significantly higher than basic job seekers allowance and job seekers benefit. Why was that, I wonder? Was that a recognition implied or by accident that the job seeker allowance and job seekers benefit is inadequate for people, for a person to live in dignity? And I asked that question rhetorically. I think we know the answer to that. So the findings, I say, are good because they support what's elsewhere, and hopefully they will inform government and policy as the supports that have been put in place. And I want to say, on a positive note, they're very welcome supports that government put in place at very short notice. The pandemic employment payment itself that was put in place almost overnight, and I think that did impact on the move to fortnightly payments. Stuart, I think, well, I'm not an apologist for the Department of Social Protection, but I think they were processing something like 1 million payments a week. So I do understand that. Nevertheless, that did impact adversely on people who are used to weekly payments. The moratorium on evictions, the moratorium on disconnections. And of course, there are fears now about withdrawing some of those protections for tenants in private residence. And I know Threshold, I think, who are here, have spoken very strongly about that in recent times. So it shows, I think the pandemic has shown as well, that things which were considered that could not be done, that there were all sorts of reasons it couldn't be allowed, even legal reasons, were found to not to be the case. So crisis can show often produces solutions as well. So I think we need to learn from that. I want to turn to as well, wearing my MABS hat too, and the Dublin region and elsewhere indeed throughout the MABS family, the responsiveness by MABS very quickly and the agility to retain and maintain the services by and large in extraordinary circumstances, unforeseen, within days. People exited, moved from home, continued to provide, for example, the National Helpline, which is North Dublin has responsibility for at the moment, kept a helpline going, and at the other end of it, phone line for people using other various channels, multimedia channels, including social media, Messenger, WhatsApp, emails, FaceTime, all sorts of using modern technology and Zoom and so forth, and that people adapted very quickly to. And we will look at maybe retaining a number of those. Also engaging through community education, using employers, reaching out to people who are in employment and maybe low-paid employment, who need advice and money advice. And quite a number of people we know are in employment, but in low-paid employment. And but using things like prepaid envelopes, information tips, tip sheets, and a variety of support tools that were developed very creatively, and then that were disseminated both physically and using other channels, social media, etc., radio, local radio, etc., Near FM, FM 104, reaching people where we're likely to reach. And not that maybe the programs people here might always listen to, but what we think other media that people access. So I think that has been enormously helpful, and lessons to be learned, but also working in partnership with other agencies. And there's such, so many examples of that, because no one agency has all the answers, and to need to look beyond our own confines. So for example, we talk about, financial management and community education. There's a very good initiative there in place with Task, and I hope, I'm not sure whether Task are with us this morning, but they do, the independent think tank, who do wonderful work as well. They're working with us, with MABS, excuse me, and the Northside Partnership, with funding supplied by JP Morgan and financial management skills training. And that came out of a report. And I know Amy's here, all right. I heard there was a question from Amy Lajoie from Task, who did a report on household indebtedness there last year. And out of that came that particular initiative. Obviously, there's a lot of increased cooperation with SVP and MABS both at local level, regional meetings, regional inputs, mutual referral processes, and at a macro, if you like, at a policy level. Vincent Hall is a National Social Justice Committee. I happen to be on it, but Gwen Harris, my colleague here, regional manager, is also on that committee, and out of that comes a lot of maybe joint submissions and problem solving very, very quickly by being at the table and talking, having that channel of communication. Also have other supports locally, and in Dublin, family supports, Astra Family Support. Of course, our sister organisation, Citizens Information Services, of course, absolutely vital in terms of providing good, independent, objective information and advocacy on behalf of people who are trying to navigate a very complex social welfare system. Also, MABS got involved in community call. So there's a range. I could list another, quite a host of other organisations with which MABS became involved. So we need to retain that. So by working, the message there is, no organisation has an answer, but by working together, you can make actually a difference while still advocating for changes at a policy level. And there is a policy, CIB produce, make policy submissions as well. So there's a forum for that. But of course, despite all that, our best efforts and the collaboration, the use of multi-channels, which are superb at reaching out to people we've never reached before, making it accessible, using the communication channel of their choice at a time, hopefully, of their choice as well. We must not leave others behind. And there was a question there, I don't know whether it was for Delma, but there was a question there about the face-to-face, the in-person. And I'd be very strong on that. There are people who either are unable to communicate except through in person, or who are uncomfortable, and who, it's a very vulnerable position a person's in when they want to go and look for financial help or financial advice. What does that feel like? If you want to talk about a person, I'm facing a disconnection with my electricity bill, I can't manage, whatever. How vulnerable are you at that situation? So it's very understandable that many people wish to engage face-to-face. And there was a colleague retiring here from North Dublin MABS there last year, and I spoke to her on the phone to wish her well before she went in. One piece of advice, she said to me, listen, don't forget the face-to-face. That's one thing I would leave with you. Do not forget that. I know we're doing all these other things, which are wonderful, but don't forget those people. And that comes across in other services as well, so that we must never forget those. The other area I think we should focus on as well is, while we have widened our reach, I think through the various channels that we've mentioned already, there are people I know myself from my work with Vincent de Paul who've never heard of MABS, who would benefit greatly from MABS. These are people on low income, the people who are coming, but there's another similar profile of people who are not coming to us at all because they haven't heard of us, they're not sure what you do, they're afraid to make that call. And we need to to consider creative ways of reaching out to those people and making it very easy. And I think that might require multi-agency efforts. For example, again, Vincent de Paul is in the homes. Well, we were before the pandemic. We are actually in the privileged position of going into people's homes. And I don't know how many times, and this is how I got involved in MABS, actually, was when I found myself often when I'm visiting a family and saying, have you heard of MABS, the Money Advice and Budgeting Service? Here's what they might be able to do. And I do recall, I digress for one moment, I do recall a family, that was trying to help, or we were trying to help, that had multiple bills, threatening letters, etc. They went to MABS, and afterwards they said, I can now sleep at night. What a tribute that was to MABS as well. I can now see the debt still hadn't all gone away, but they could see a way of managing it, and so that reaching out, that family had never heard of MABS, and there are hundreds of such situations where people who would benefit from MABS, but who haven't engaged, haven't heard of them. And even some service providers. I was talking to a service provider recently, never heard of MABS. So we still have more work to do in that area, I'm saying. But anyway, so let's retain the good things that we've learned, the lessons that have been learned from the pandemic, the agility that we've shown in responding to people, the responsiveness to reaching out, the collaboration, the mitigation of the pandemic, the effects of the pandemic. But I just quote the few figures that Vincent Paul released yesterday. The more recent ones, the earlier findings were similar to our experience, was similar to what Stuart had found in his excellent report. But just remember, I think some of these figures will point to, I expect, a significant increase in the calls on MAB services as we ease out, whenever that might be, of the pandemic, and the financial supports are withdrawn, presumably. And we did see an indication that September, October, and the helpline, when we began to open up, just I think that was touched upon as well. 24% of people in the survey was Red C conducted were saying they're cutting back on food, rent, or electricity. 24%. 22% are using savings on just essential items, not luxuries, day-to-day living expenses. 14% are falling behind on bills, such as rent, mortgage, utilities, or other payments. 7% are going into debt. These primarily the trend, not surprising, low-income families with children, lone parents in private rental accommodation, people who are sick or on some sort of a disability payment. So there's a challenge coming. We need to make sure we have enough resources to do that. We need to have the services in place, and doing it, we can do resource MABS, of course, properly to do it, but also build on the cooperation with other agencies, so that collectively, at least, we feel we can make a more meaningful difference to people's lives. So I conclude on that note, and again, I congratulate Stuart on his excellent report, and the staff for the cooperation, and also just on a personal note to wish Angela all the best in her new chapter. Angela encouraged me to remain within MABS when the regional companies were being set up. So thank you for that encouragement, Angela. Thanks very much, Sean.